Bismillahirrahmanirrahim. Today my topic of presentation is Devolution and Kleinman model of health sector under supervision of Professor Dr. Saira Afzal. In this presentation, I would be discussing a brief introduction to health sectors, a few slides on district health system, then a detailed discussion on devolution, objectives, analysis, what is the way forward, and at the end there would be some slides on Kleinman exploratory model of health sectors with recent advances and MCQ session. At the end of the presentation, the participants will be able to describe the basic concepts of devolution and implementation of Kleinman explanatory model for health sector. Now a little about district health system and devolution. According to WHO, the district health system is a self-contained segment of a national health system. It includes institutions and individuals that are concerned with the improvement of health in any health system. A district health system is a manageable unit that acts and integrate health programs both in coordination with government and private sectors. It is working tirelessly to identify the inequities, and it also has joint intersectoral sections. And community participation is more and more appreciated in this district health system. There is a district health unit, and it is defined as an area with local administration and representation of different sectors and departments. An area which can serve as a unit for decentralization of intersectoral planning and healthcare, and it is a network of health facilities with referral support. Usually there are the four main sectors that are working in coordination in an well-organized health systems. This includes the public sector, the private sector. The public sector includes all the public sector hospitals and the organizations that are directly under the local governments. The private sectors that are working individually and are self-funded. There is also civil society and other NGOs and other independent units that are working in coordination with this public and private sectors. So a general health system has several principles like leadership and governance, resources, and it leads to service delivery that leads to outcomes like universal access, coverage, quality care, and the goals is to improve health with social and financial protection of the people. Now coming to the devolution. What is devolution? Devolution is a form of decentralization in which the responsibility and authority is transferred from the main government, separate administrative structures that are still within the public administration. Actually, there is the shift of authority from the main federal government to the provincial government, and in this provincial government there are units that are working in coordination with the elected local governments. So the shift of responsibility and authority from the central offices to the separate administrative structures that are still within the public administration, such as local elected governments. And there is flexibility that they can raise their own revenues and have independent authority to make investment decisions. In Pakistan, current provincial decentralization came into effect with passing of 18th Amendment on April 19, 2010. This was not not a technical measure. It was a unanimous consensus of all political parliament parties, and 21 sectors were devolved to the 4 provinces. And the provinces were to legislate, steer, and manage the health sectors as per their budgetary constraints. But it must be kept in mind that this devolution or decentralization must not be confused with the prior attempts of decentralization. There were prior attempts as a part of local government reforms in 1959, 1979, and 2001. So what was the main objective of this devolution? It was the first objective was to transfer the power from the federal to the local government. Second was to authorize the provinces to devise policies for current health issues, keeping in mind the equity, that is the need of people as they are closer to the targeted population, and to devolve decision making regarding health matters. So there was a shift of power. The 2010 devolution provided an exclusive shorter list to federal powers and a longer list to exclusive provincial powers. The main shift of powers were falling under the following categories: the health planning sector, legislation and law, the service regulation, the budgeting and the finance service delivery, the recruitments, the financing, the pay and the recruitment of the new health staffs comes under human resource productions, and service delivery programming were devolved to the provinces. So after the implementation of this devolution, there was if an analysis is done, then three main questions are raised. Keeping in mind the core objectives of the devolution that was passed in 2010. One is, did the devolution resulted in health getting more equitable share of government funding? Did provincial policy role leads to improvements in health planning process? And did provinces implement more locally responsive solutions? These are the key questions to be addressed to see the success of this devolution that was implemented in 2010. So, has there been more spending on health? This is the table showing the allocation of the health in different provinces, and it clearly shows that the total per capita allocation on health was increased from 2009 to the year 2014 and onwards. Therefore, the provinces reacted to devolution through a visible increase in government spending on health so far, and increased budget allocation for health is seen in all provinces, ranging from 50% to threefold more, so especially in Balochistan and Sindh. But the next question was, how well the resources being allocated? It was seen that with the increased budget in every provinces, the main part of that budget allocated for each province was going to mainly to the salaries of the that salaries continue to consume the major portion of the provincial health budgets, and with less investment in supplies and quality care. And most of the budget was used for the recruitment of doctors and specialists rather than going for the training of the less costly frontline healthcare workers that are more suitable for Pakistan rated rural areas. Has planning improved? Provincial planning and governance initiatives were taken in different provinces in Punjab, Sindh, Khyber Pakhtunkhwa, and Balochistan. Planning was roadmaps were developed in province Punjab and Khyber Pakhtunkhwa, and in Sindh there were district action plans were developed, and in Balochistan the sector strategy was developed. The regular authorities were established and functional in Punjab and in Khyber Pakhtunkhwa, and were also notified in Sindh and are still under consideration in Balochistan. Service delivery integrations were functional into 3 programs in Punjab and single integrated project, but parallel program coexisted in Khyber Pakhtunkhwa. But in Sindh, they were functional integrated, but in Sindh and Balochistan, they were proposed integrated service delivery systems, but they were not implemented. And private sector involvement was there with new modalities and regular health commission contracting out equipment and technologies in Punjab and in Sindh. And Balochistan is still developing its private sector coordination and service delivery integrations. In most of the provinces, the planning process moved downstream to the district health plans. As I've already told, that roadmaps are placed in Punjab and Khyber Pakhtunkhwa to improve the public service delivery, and define targets. Regular stock takes and investments in digitalized monitoring were more focused in these provinces. So far, they remain unevenly implemented and only partially adjusted within health budgets. Several gaps were identified with the implementation of this provincial and district unit systems. There was a disadvantage start in terms of technical capabilities. The provinces were not prepared for this responsibility, and they had several issues for the technical capabilities. Only few workshops were arranged for the awareness, and there was a situation of little confusion in the start, and there was an abrupt transfer of power with dragging feet by the federal ministry was another issue, and there were also unresolved financial gaps that continued for several years. Now, how can we deliver better? What can be done more for the ease and for the success of this provincial and local government system? There is a need for health leadership training, professional human resourcing. There is a need for recruitment of uh, professional workers, and also the people that are relevant to the domains, and that have the knowledge, and that have the technical knowledge regarding the this system. Latest technology is the need of current era, and there is a need that government should invest in the latest technologies. The financial management system needs to delivery needs to be speed up, and there is another point that the frequent transfer as posting at the senior management level must be discouraged, and there must be set limits, so with the interference with the political pressures, and there must be some efforts taken to reduce these political pressures. Summarizing the whole process, there is a feeble national health coordination by the federal level and insufficient investment by the provincial governments in the health stewardship capacity and restructure are the constraints. Vulnerability to the local political interferences is another bottleneck requiring firewalling. And health decentralization will require continued federal provincial engagement on sorting unresolved boundaries. Since the more powers are given to the provinces, but still the federal and provincial engagement at solving the problems for health sectors is important. Now, a few slides regarding Kleinman explanatory model for health sector. Actually, this is a model that was presented by Kleinman, and this was the original paper that gave the brief description of the model that related the concepts present in ethnographic and comparative research in medical systems as taking it as a cultural system. So this model is in overlapping sectors of healthcare and that helps people understand how illness is defined. And it can be concluded that during the time of illness, we follow a hierarchy of resort. This is the main model that divides the health sector into three sectors that includes the popular sector, the folk sector, and the provincial sector while dealing with the illness. So the popular sector includes the perceptions, the choices, decisions, roles, relationships, symbols, and behaviors, and it may include the people that we see every day, and and the people that seek advices from the people, from their relatives, from their close friends, or may join some online counseling sessions or online health sessions. Second is the folk sector. That includes the traditional medicines. This is common in underdeveloped countries where cultural background people have strong cultural backgrounds and their beliefs are strong on the traditional medicine like hikmat, akim, and spiritual healing. The third, that is the more popular in European side and also as well as in the Asian and other underdeveloped developing countries, is the professional sector that includes the medical professions and the Western allopathic medicine. So the popular group is the people you see every day, and maybe someone who has seen the illness or experienced it themselves, and it's called the popular sector. And here the people will join self-help groups and online support groups. Second is the folk sector. The next possible sector is the folk sector. And for example, the people having the cultural background may come up to the treatment like relieving the back pain with massage. In some cultures, sacred healers and the spiritual healing is also falling comes in this sector. Third is the professional sector. I've already told that the patient is now under control of the doctors and who prescribe medicines and label them as sick or healthy and ultimately treat them. So, taking an example of dementia, for popular, then this they for popular, if a patient is suffering from dementia, then maybe a family member or a friend tells you that moms keeps forgetting how to unlock her door, or dad can't remember how to open or tackle the box. So once you start to realize someone differences, you may look up some possible causes on internet. So it's a self sustained, or you can say there is a self treat groups in popular category. If we take the folk side of this model, then besides medication, early stages of dementia patients have recorded tips on living with dementia: keeping a calendar, notes everywhere, using medicine dispensers, having a newspaper delivered to remember them, exercising are a few examples of how life can be made easier. Once a progressed state of dementia reached, medications and professional inputs are required, and people may also go to the hakims and the spiritual healers in our settings. The professional is, once you have strong understanding on what is happening, you will most likely take the individual to a doctor. And most people in Western side especially need the doctor verification. So this is definitely very understandable what an illness as transparent as dementia. Now it's time for the recent advances. This is a paper that was recently published showing the impact of devolution of government size and provision of social services. And this paper demonstrated that devolution is associated with large government size, which provides empirical support for common pool hypothesis, implying that the decentralization that matters for the size of government depends on how subnational governments finance their expenditures. Moreover, the findings suggest a significant increase in the magnitude of health and educational facilities at a local level following devolution reforms. So there are some advantages of this devolution at local government levels. This is another paper recently published showing decentralization and the limits to the delivery service, evidence from the northern Pakistan. So the results of this paper demonstrated that political dynamics, such as nature of relationship between district governments and the provincial governments, the extent of political polarization, prevalence within and among different levels of the local governments, and the role of bureaucracy are the important factors that ostensibly account for the deterioration of well-being outcomes in the northern areas like Sawabi district. And these findings suggest that political factors have overshadowed technical consideration in terms of explaining these outcomes of decentralized service delivery. This was a paper published in BMJ Global Health with health system changes after decentralization, progress, challenges, and dynamics in Pakistan. And this paper highlighted that in decentralized Pakistan, health became prioritized for increased government resources and achieving good budgetary use. And however, allocation probably were not efficiently adjusted. And three things were highlighted in this paper: that there is need for investment of technical capability development, need for technical support for central level to shift to new modes, and measures are needed for political management of decentralization to safeguard against local political pressures, and leadership stability is also needed. Now it's time for the MCQs. After Devolution 2010, which items in the government budgets accounts for the greatest portion of the total health expenditure? Either it's the recruitment of the doctors and their salaries, purchasing of the new technology, building new hospitals in public sectors, and training of new frontline healthcare workers.
A.
Yes, it was seen that although the overall budget in every province was increased from year 2009 onwards, but most of this budget was invested in recruitment of doctors and and went to the salaries of these doctors. With devolution, there is a transfer of authority from federal to provincial government. While devising policies for health issues for targeted population, the provinces must keep in mind which of the following: the equality, the equity, traditions, beliefs, and attitudes.
B. Equity.
Equity is the right answer because need based allocation of the needs of the people must be kept in mind, and equity is an important part in this devolution. An organization deals with policy making and implementation. In this organization, the decision making freedom is available to the lower level managers. This is an example of either decentralization, centralization, autonomy of efforts, or congruency.
A.
Yes, the answer is A, decentralization, because when the decision making freedom is given to the lower level managers in any institution or any organization, then this is the example of decentralization. Fourth MCQ is: Bilal is an 8-year-old boy but still wets his belt almost every night. He is ashamed of this and ridiculed by his cousin. His parents are worried and take him to the doctor, who refers them to the psychiatrist. The child gets medication and returns home. According to Kleinman's model, this is an example of professional sector, folk sector, popular sector, personal sector.
A.
Yes, it is the professional sector, that the parents took the patient to the doctor, who referred them to the psychiatrist, and the psychiatrist or the main doctor treating the child. So the answer is A. A TV compare becomes terrified of speaking in public, and he cancels his speaking engagement for fear of getting embarrassed. Instead of seeking treatment by a trained health professional, he joins an online support group for changing his perceptions and beliefs. This is an example of professional sector, folk sector, popular sector, or personal sector.
C.
C is the right answer because whenever you are seeking help from an online support groups, and perceptions and beliefs, they all fall in the popular sector according to this model. Little Mobeen has recurrent allergies and must receive injections to counteract them. He became fearful and cried whenever he gets his injections. The father decided to take him to a Hakim for traditional medicine. This is an example of professional sector, folk sector, popular sector, personal sector. B is
Folk
the right answer. Right answer, since traditional medicine is involved, so it's a folk center. A 30-year-old lady who is 38 weeks pregnant refuses to have cesarean delivery, even though without surgery the fetus could die. Doctors fail to convince her, and she seeks advice from a lady and her close relatives for choosing a better mode of delivery. This is an example of professional sector, folk sector, popular sector, or personal sector.
Personal sector.
This is actually it is an example of the popular sector. Whenever you seek advice from the people you closely related or see every day, then this is the popular sector. The 2010 devolution provided a longer list of exclusive provincial powers that is charged with finding, screening, recruiting, training job applicants, and administering employee benefit programs. This all comes under the domain of legislation, service regulation, finance service delivery, human resource production.
D.
Yes, the answer is D because all these domains fall under human resource production. Public administration, which is found at the lowest tier of the administration in each state, is in the form of either provincial government, federal government, local government, or a union council. In
D.
public administration tier, the local governments fall at the lowest tier of the administration. For proper functioning of the country, the main sector of any health system includes the public sector, the civil sector, and the NGOs, which is the missing sector, the private sector, the religious sector, teaching training sector, or heritage sector. Yes, A is the right answer.
Private.
The private sector, because the main sectors for working in coordination with each other for a good health system are the government, public, private, civil sectors, and NGOs, and the other independent sectors. This is the key, and thank you.